Good afternoon, everyone. We wanted to welcome everybody on to the webinar for Navigating Moms in Postpartum Care. We're excited about engaging in this conversation as we know that it is so important in our community and within our network, how this conversation leads to so many opportunities for support in postpartum care. So I want to welcome everybody today. We know that you guys are navigating and juggling busy schedules. You're probably in your lunch hour. So we just want to say that we are thankful for you taking the time to share in this such important conversation. Just a little bit of virtual housekeeping. I wanted to let everyone know that the video is being recorded and it will be available on the Health Evolve Technologies YouTube channel later this week. So you may access it for replay on YouTube. And then another thing, how do you get the best out of today, right? We know that you're taking the time to be here, so you're invested in this conversation. So we want to encourage you all to join in the chat. Go ahead and comment, put in your insight and suggestions and questions that you may have as you're coming from your background to have conversation in this space. We want to ensure that you guys know that this is a safe space for conversation. Feel free to ensure that you're sharing in this space that you can be comfortable and safe as you are putting out your comments and questions in this place. First test for you guys today. So I want you guys to drop in the chat where you're logging in from, where you're listening from, your state, and even your city if you would like to. We would love to see who's on this conversation with us so far. Where are you joining from? All right, so we have Columbia, South Carolina. Anyone else? Logging in from Camden, South Carolina. Welcome, Susan. Welcome, Amy. Anyone else want to chime in on where they're logging in from? So we have Tiffany T, who's from Columbia, South Carolina. From the Grand Rapids. She currently lives here. Irmo, South Carolina. Excellent. So welcome, you guys. Thank you all so much for sharing. So next, I want to bring up Miss Kimberly A. Smith. She is the brains behind Health Evolve Technologies. She will give you guys a welcome. And Kim, if you will come on to the webinar, please.
Absolutely. Thank you so much for that welcome. It is such an honor to just have a moment to share my gratitude for the conversation. As mentioned, I'm the founder and CEO of Health Evolve Technologies, and we are a young software company that is really committed to closing the gap on health disparities, and particularly with women. So today's conversation is extremely meaningful to us and the work that we do at Health Evolve, especially when we talk about postpartum care. You can learn a little bit about me later because that's not the goal of today. But what I am excited about after our conversation on the postpartum care period, you will have the opportunity to learn a little bit more about what we're building regarding managing care during this such a critical time. So thank you again for being a part of the discussion today. And I'm going to hand it back over to Rhonda to move us forward.
Well, thank you, Kim, for the work that you do. It's so important. And we are in full throttle supporting you on this journey. So we appreciate your efforts and your boldness to be able to be in this space as well. So thank you. So we don't want to hold time. I just wanted to introduce, I will be your facilitator for today. I am Ms. Rhonda Sims. I am the creator and founder of the Mom Mic podcast, which gives an opportunity to create a safe space for moms during their highs and lows of motherhood. We know that oftentimes we don't talk about this journey, but we know that we need the support, and that community is specifically built for you to have authentic conversations. I've been an activist of maternal health for the past 8 years. Since I birthed my own first child. And during that time and that journey, I lost 2 friends due to preeclampsia during childbirth and after childbirth, which is my motivation behind the work that I do as an advocate in maternal health. Since that time, I facilitate and advocate for community events, teaching others about maternal health, and particularly practices for women of color. I newly just took on a new role as the outreach manager for the Preeclampsia Foundation for Mama's Voices, which is the first maternal health care Patient Advocacy Coalition, which amplifies the voices of those who experience child loss and childbirth complications. So I am your facilitator for today. I will be navigating you guys through this journey with us for this hour. So thank you. I will move in to allow our amazing panel to introduce themselves. You guys are up for a treat this hour. We have some very dynamic women who are expertise in their own way when it comes to maternal health. And I am just so grateful to be in their presence and learning from them as well. So you guys have a treat for today. So I want to start first with Dr. Ard, who will come forward and introduce herself. One of the things we want you guys and encourage you guys to do is that these women are doing so much great work. We want to ensure that you guys are supporting them, that you're reaching out to them in whatever collaboration and way that you can to ensure that they can continue to be supported in their work. So Dr. Ard, if you would come on and introduce yourself.
Thank you so much, Rhonda. Good afternoon, everyone. My name is Dr. Quantrilla Ard, and I'm so excited to be here with you all this afternoon. I am a mom, a wife. I have so many hats that I wear, but some of my favorite ones that rise to the top are mom and maternal health advocate. I am very passionate about community voice and lived experiences. And so my personal experience with preeclampsia really prompted me to become an advocate to bring other voices to the table who traditionally don't get invited to the table. So that is a little bit about me. I am also a behavioral scientist, so I love digging into the why behind maternal health and infant health. And so I am looking forward to this wonderful conversation today. Thank you.
Thank you, Dr. Ard, for that introduction. We're glad that you're here and we're excited about what you will share. Next on the panel, we have Tiffany Connors. Y'all, we've had the treat to have two Tiffanys on our panel. So they're so excited to have two T's. So Tiffany Connor would come up and introduce herself and introduce herself to the panel and what work you're doing.
Okay, thank you so much. Listen, let me tell you about these 80s and 90s babies who got Tiffany's as their name. It was a very popular name at the time. So anyway, I digress. My name is Tiffany Conyers. I am a licensed clinical social worker in the states of South Carolina and Georgia. I'm the owner of TC Solutions. I'm a podcast host. I also do a lot of work in maternal mental health and the perinatal period. So certified perinatal mental health specialist through Postpartum Support International, where I offer my skills as a faculty member. I help train other professionals, whether they're therapists or OBs or midwives, OTs, any professional that touch someone in their reproductive journey. They really need to know about the mental health complications and victories that can happen during the perinatal period. And so there's a training that I do with Postpartum Support International. I'm a support coordinator for the Midlands that covers a little portion of South Carolina where those who are struggling in their mental health during this perinatal period can actually get support by contacting the hotline. I'm adjunct faculty at the University of South Carolina, and I speak Spanish fluently. So as a practicing therapist, I really do touch the lives of a lot of BIPOC community members. So that's whether they are African American, a marginalized group, or Spanish speaking. That's what I do. I'm a mom of four. I have an angel baby who we've experienced our own perinatal loss. And then I have three little ones that I'm helping keep alive. That's the goal every day. And I'm a wife to one. So I just want to put that, just in case somebody was wondering, I'm not looking for anybody else. I'm taking. So
Thank you, Tiffany, for sharing. I'll tell y'all up for a treat, like just some amazing things that you guys are doing. So thank you. Thank you for sharing your story and your purpose behind what you do every day. All right. Next up, we have Miss Tiffany Townsend. If Tiffany, you would come forward and introduce yourself.
Good afternoon, everybody. My name is Tiffany Townsend. I am a mother of five, first and foremost. I love my babies. Also a woman who has experienced childbirth throughout many ages, right? I was a teen mom. I got married and had additional children. And so I come at this from a professional place, but as well as like walking through and understanding like what gestation looks like for us, what it looks like in teen age, what it looks like in old age, and what it looks like, you know, the age that everybody kind of expects. And so I come to the table bringing a lot of years of experience as a home birth midwife, something I'm very passionate about, but something that I really, really like to say when I'm in these spaces is that when I come to speak here, I always come with the idea that like our bodies are not broken. I feel like a lot of times we come into these spaces and we're like, Black women are likely to have that. I come here with like solutions and answers and ideas. And so that is something that really, really drives me. And not just focusing on the hard things, but also just like saying, what can we do? What are our solutions? Like, it's not all doom and gloom. And so I do bring hopefully a ray of sunshine when we talk about these difficult conversations, because we have solutions. And I truly believe that the solutions are found within our community. So I'm so excited to be here with you guys today.
Thank you, Tiffany. Yes, I love Tiffany. We worked together on a previous project that we have been on. So thank you for agreeing to be here. So thank you for the opportunity. So a little bit about the layout today, because we're about to dive in these questions and we're about to get some substance going here. A little bit about the layout. We will go through 3 big, hairy questions that are very prominent to postpartum. Of course, we can dig in so many layers when it comes to postpartum care, but we're going to focus on 3 overall arching questions for today. We will provide some stats around these 3 questions, as well as we will have Q&A at the end. Please remember to use the chat feature to share. We want you guys to respond on these questions from your perspective and your experience in particular, because we want to make this as personal as possible. So we will open up with the first question and allow our panelists to chime in based on the work and expertise in their area. So our first big hairy question is, what is the greatest challenge that postpartum moms face?
All right, I'll kick it off.
Hey, Dr.
So I am not on the clinical side of maternal health, but I have a pretty large community of moms and birthing people. And one of the greatest challenges that I hear from them, again, because I collect stories, we talk a lot about lived experiences, is that they don't feel cared for after the baby comes, right? It's all of this attention and this focus on them while they're pregnant. But once the baby gets here, it's like, what am I, chopped liver? So it's almost a forgetting of the mom or the birthing person after the infant arrives. And of course, they work together. The mom and the baby are together, right? And we should not separate care, because now this infant is here and, we see this beautiful baby, helpless, just, but also there is another individual that needs just as much care, just as much attention, and just as much support. So that's one of the biggest challenges that I hear when I talk to folks about that postpartum period.
I totally agree. I think that we have to remember that we were created to be in community. And so what happens is we carry this burden of like being strong and resilient and to work 2 days after having a baby, and we're living and existing in very abnormal conditions. And so, like you said, there is a lack of support and community, but we always have to kind of think about like, if I'm not getting what I need and people don't know, like having a plan while you're pregnant about who is going to show up. Because I tell clients, I tell friends, I tell myself as someone who has struggled with postpartum depression, like if this is a possibility. Like, how am I going to make sure that I protect myself and my baby? Because if mom is not well, if the person that gave birth is not well, everybody is at risk. And if we use that language and we say, hey, if this mom drives her car off the bridge, then who is responsible? Where's the community? And those are the people that we want to come forth and kind of help. And we have to be dramatic like that because we see it happening and there's no compassion. And so I agree. Community is missing, but we have to like kind of start planning for that when we find ourselves pregnant unexpectedly, or even if we're married and everything is perfect, like we know things can still go wrong. And so kind of trying to think about like, if I don't have a mama and an auntie that has some sense, then my homegirl should be able to pull up and say, girl, I'm about to do your laundry. I'm about take a little minute, I'm gonna bring you some food, and like, what can I do to help and support you? And it really makes such a huge difference, and you don't even have to spend money to support anybody.
I would definitely like to piggyback off of what was articulated in this as a greatest challenge is definitely not understanding your need for community. So having some real prenatal planning for what postpartum experience is going to look like for you, what help, who's not helpful, who you don't want around that's not going to be helpful, okay? And being able to actually say and express and give permission to say that I do need you to actually do my laundry versus hold my baby. I can do that. I got it. We do a skin to skin. I'll try to, build my milk supply, whatever I got going on. But being able to say that my toilets are raunchy, like, can you help with this? So I think the need for community, and Tiffany T, you also mentioned something that I think is another biggest challenge. It is mood changes that happen during the postpartum experience that many people don't talk about. So if it is that I am struggling mentally or emotionally, and that this bounce back and this snap back and the fantasy of what my postpartum experience is not living up to that, I can get depressed. I actually can experience anxiety. Don't let there be complications during the birth. And now I have a medically fragile child, or I'd had a NICU experience. And so my anxiety level is higher and I can't really express that. Or I'm having attachment issues with this kid. I don't even like this kid, but I can't tell anybody that because that's not really cute and cuddly. Nobody wants to hear that kind of stuff. So I think the biggest challenge is being able to honestly articulate what you need, and there being a community that can answer the call.
Thank you, ladies, so much for sharing that. All of that resonate with me, personal experiences, and many of the women that I speak to often, and those who have encountered, childbirth experiences. Even with that, we talk about, your practices and the things specifically that you have seen, but there are stats out there, that support a lot of this information that you guys are sharing. So let's look at some of the stats. We see that, postpartum preeclampsia is increasing, and 60% of preeclampsia is preventable. And I don't know if many of you know what preeclampsia is. It's a time where there may be a fluctuation in blood pressure, and it creates a situation in other organs in your body that may be at jeopardy. And it can be a very scary condition that comes up with preeclampsia. So 60% are preventable, which makes it seems very scary that a lot of women lose their lives to preeclampsia, but more than half can be saved because it is preventable. Heart disease and stroke are a leading cause of maternal health disparities. Nearly 40% of moms miss their postpartum checkup, and 1 in 4 American moms return back to work within 2 weeks of giving birth. And we know that this is different across the board. Like, we think about other countries, and other countries experience something totally different. They have a different perspective when it comes to supporting the postpartum mom. So, as we're looking at that and where we're serving from, that's so important. Access to personalized and equitable care is still not in reach for all moms, and 1 in 5 to 7 moms will experience some sort of prenatal mood disorder during pregnancy and postpartum. And all three of you all mentioned that same concept. So these are the stats. These are things that we're seeing across the board when it comes to postpartum care and support. And this is our reality. So anyone want to chime in on the chat? I know we've been kind of interacting a little bit. If you have a personal experience, what things about your experience may be something that was missing during your postpartum that you can kind of reflect now, as you're in a different state, if you're expecting a child, what things are you preparing for to use and to take with you? So we're going to move on to our second big hairy question. It is, what have you seen in practice that supports postpartum moms? And I know many of you have experienced these things. Tiffany, like, look, my hand is up. Let me go first. So Tiffany T, I seen your hand up first. You're ready. Please chime in on, what things you have seen that support postpartum moms.
Thank you so much. So number one, you spoke about it. You have a baby and you're seeing at 6 weeks. Like, as a midwife, I'm coming to see you at 24 hours, at 1 week, at 2 weeks, at 3 in the morning if I need to, at 4, until everything is good. There's so much that can go wrong between birth and 6 weeks. And also, please keep in mind that when someone has a surgical birth, which is opening all of their abdominal muscles, they are sent home with no physical therapy, no support. Nobody's making sure that that cesarean scar is not inflamed, infected, anything. And you're taking care of a baby. Think about, if you're already a mother, how much you don't think about yourself, right? So you got this brand new baby you're supposed to love. And like Tiffany C said, those attachment issues begin, and you don't want to be like, I really do not like this baby. I really could put a pillow over his head, because you have these intrusive thoughts which are caused by hormones and all kind of other things. So the number one thing that I have seen is being there, being in the thick of it, and being a safe space where you're not concerned about me calling CPS because you are telling me these things, because we're working to get you connected to resources, connected to help and meds, and destigmatizing meds if it's necessary. Like, sometimes you're gonna have to go on some medication until your hormones are back to how they need to be, until you're feeling a little bit back by yourself, and maybe we can wean off. But having a provider that is there, that cares, and is not overly extended to too many clients is very, very helpful. Because even if a person isn't saying I don't feel well, you can tell if you come into an appointment, you leave your baby in a car seat on the floor and you just here, right? So then it's my job to say, hey, how are you feeling for real? I'm noticing, the baby's crying, he's rooting, he wants to eat, and you really not feeling it. Tell me what's going on. And then they'll be like, I feel so guilty. I don't care about this baby. I'm having all these thoughts. But you have to create the space for them to say hey, you got to be there. From 1 to 6 weeks, there's no way for you to pinpoint and identify that. And to piggyback off what we talked about the last question, if there's no community, then you in the house with a crying baby a lot and you're losing your mind. So being there as a provider is super helpful.
I want to jump in like double dutch. So, so I think, the conversation about what we've seen be helpful really needs to spread across the board. So I just really think that Healthy Evolved Technologies is onto something great, because I don't think that having voices of us saying this is working, try this, in some of those spaces is happening. I don't know if it's happening like that, but to jump in and say providing that safe space, that place to be able to talk, seeing clients in the spaces that they're in. I think like Tiffany T, just the fact that you said, I see them 24 hours after birth. I was like, oh, that needs to happen. Waiting 6 weeks, so much has popped off in my life as a birthing person, my emotions, challenges that I'm having physically, and attaching and connecting with my baby, my partner, and all of that, trying to navigate all that. 6 weeks is a long time to not have some type of encounter or contact with the provider for me, because we do see a pediatrician. If we have a living baby or a baby that we brought home, then more than likely we've got probably at least 2 pediatric appointments within that time period. So how can providers that are other than OBs, midwives, and nurses, and postpartum doulas, we love the doulas, how can they also be there to ask those questions? How are you connecting? How are you? Is this the first time you showered in a while? Because they were like, I got an appointment. I can't be stank. So I need to make sure I show up right. And then let's talk about how you've been. So screening for mental health issues and complications has been supportive. Connecting them with resources that look like them, that speak their native language, is supportive as well. I've seen that be a huge bridge to getting them connected to services and care in the postpartum period, especially after they've had a delivery.
I totally agree with everything the ladies have said. I just quickly wanted to address one of the stats from the last slide about 60% of preeclampsia being preventable. Just to clarify, preeclampsia itself, the health condition is not preventable, but mortality and morbidity associated with preeclampsia can be preventable if you catch it early. So that's one of the things that, when we talk about supports, finding ways to have touch points with new moms prior to 6 weeks is critical, because you have this huge uptick of postpartum preeclampsia, and that's within days, sometimes hours, of being discharged from the hospital. So if that mom or birthing person had to wait 6 weeks, not only could they have extreme health challenges due to preeclampsia, but they could die, right? We've all heard of the story about Tori, the Olympian, right, who had this preeclampsia thing happen while she was pregnant. But the bigger issue was that she was alone, right? And so we see this happening prior to delivery, but imagine a mom who, like we said, may have had a C-section or may have had a really traumatic delivery, right? And they're sore, or they're just not feeling well. And the first thing that they think, oh, I don't need to call my doctor, I'll see them in 6 weeks. No, there could be, things going on in their bodies, right, that they need to have addressed immediately. So I have heard conversations from other providers that are saying, hey, we're not going to wait 6 weeks to see our patients, right? We know that they need the support immediately. Like, is there a home health nurse that can call within 24 hours to check on the mom? Is there, maybe a case manager, if you have social services from the community, is there a case manager that you can touch point with, in a week or so, right? Like, we know that these moms and birthing people cannot wait 6 weeks. And so I'm excited to hear conversations about providers who also are saying, you're absolutely right, we cannot wait 6 weeks, and are trying to change not just what is being seen on the outside, but they're actually trying to change policies and procedures so that this can be instituted to save postpartum moms.
Thank you, ladies, so much. Like, resonating with me, like Kim said in the chat, a common thing that we're hearing is the value of community. And when she said that, I thought postpartum village, like, we prepare and we have a prenatal village, but where's the postpartum village? And we have to be prepared for that just as much as we are prepared for the prenatal. So thank you, ladies, so much. That theme is across the board. Here are some stats that we wanted to share with you all. So we see here that the American College of Gynecology recommends a comprehensive assessment of the postpartum mom, including mental health screening within 12 weeks after delivery. And I think we chatted about that a bit, that 12 weeks is a long time, that touch point should be much earlier than 12 weeks. OBGYNs have aimed to follow up with mom within the first 4 weeks of postpartum care. And midwives have been utilized to support moms during pregnancy and postpartum. I know doulas have too. I can speak personally on midwives, Tiffany, as well. Personal experience is, next morning, they were in contact with me. They came to my house the next day and visited that next week. So it was a consistent support system there with midwifery. Moms have options outside of traditional care setting to receive medical care, including i.e. midwives, doulas, etc. So that's so important in that process and that practice to ensure that we're touching the mom earlier, immediately is important. So anybody want to chime in the chat group? I wanted to pull a couple of the comments here. I know Nina expressed that she piggybacked on the C-section comment that was made. I think Tiffany mentioned it, that most of the moms are only instructed to not climb stairs when they have C-sections. That's about the most education that they get. And I can testify to that one. And Amy included in her chat, it is important not only to have community, but for that community to be willing to jump in and support in ways outside of holding the baby. Weeks after my last birth, I had community visits and gunk when I said, what I really needed is someone to load that washer. Real support looks different, and it really does. Let's see if anybody else had anything on here. So yeah, so thank you guys for chatting and engaging in that. That perspective is valuable to us as we continue to support the postpartum community. So we're going to dive into our last question for our panelists. And our last big hairy question is, what role can digital health play to improve maternal and maternal mental health outcomes? We know that we are in a technology world, and everything that we do is geared towards technology. So when you think about it, what role can digital health play? How can we utilize that platform to bridge the gap between communication between the patient and the clinical?
Hey, so I think about the age group of those who are in their reproductive journey, and that those that are in this time period grew up always having access to some type of device that connected them to the World Wide Web, to the inner worlds, the internets, all of the things. And so I think about having a tech savvy patient or client in front of me and how they are even more inclined to even get their information about what they're experiencing, not necessarily from a phone call to their provider, but from a Google search or some type of search engine that's going to tell them and help them diagnose what they're experiencing. So I think it's a huge opportunity for us to reach a group of individuals that are very savvy and proficient in the digital world. And so I've seen it work prior to the pandemic. I offer virtual online sessions to moms and birthing people in the community. And then, of course, saw uptick, of course, during the pandemic of the need and for support groups as well as access to their therapists or access to their mental health providers. So I know it will play a huge role, especially in the work that I do, to reach and connect those to their mental health recovery in real time, because it could be synchronous or asynchronous type of support, and being able to connect them to even crisis help. If I am experiencing a mental health crisis, a digital platform can make a world of difference. So it's definitely playing a huge part in their recovery.
I totally agree with Tiffany here. And the word I keep hearing is access, right? There's a huge gap in access to care, especially for moms who may live in rural areas, right? We have maternity health deserts where, folks have to drive an hour, 2 hours plus to get care. And digital health not only, limits that gap, but for some, it can totally remove it, right? And not only is community important, but establishing a care team is important as well. And for folks who cannot access care teams due to distance or other barriers, digital health actually opens that access back up to them. And I think it's so important for us to really kind of move this forward, because there are so many people who need access and don't have it. So I think digital health really kind of meets that need in a way that's both valuable to people and doesn't provide harm, in that it's not an extra push to get them to use something that they're already using. So I love digital health.
And like Tiffany said, access. During COVID, everybody was sick and we were seeing all these people dying. And what I realized as a midwife was that I can very easily empower people to be a key player in their own healthcare. Like my job is not to be like, this is how you sustain a healthy pregnancy. My job is to say, hey, can I teach you some stuff about how the body works? Can I help you understand that if you eat 100 grams of protein every day, if you take your vitamin D at 5,000 to 10,000 IUs every day, if you take magnesium and calcium every day, you are reducing your chance of having maternal hypertension, you're reducing your chance of gestational diabetes, you're increasing your chance. But when we're in these healthcare systems, like nobody's teaching. So that aspect, but also saying like, hey, here's a Doppler. If you have questions or concerns, here's a Doppler, here's a blood pressure cuff, call me and we'll listen to baby together. Oh, you're 4 hours away and you just want somebody to kind of walk you through. Let me teach you how to make sure your baby's okay. Let me teach you how many times your baby should move in an hour. Let me teach you how to keep track of like a normal fetal heart tone. People have to be empowered with education because we are not the saviors. We are here to empower people with education and say, hey, here are things that I have seen work. Let me give this gift to you of knowledge so that you can incorporate that. And hopefully you tell your next friend that's pregnant about these simple things that we can do. We talk about, having early babies. Well, we know that vitamin D is one reason that people are having preterm babies. Why are we not screening every single person and saying, hey, your vitamin D level is 7. It should be 60 to 70. Like that is very low. It increases your chances of depression as well. Like these things are simple, easy, simple solutions. And so I believe Susan asked the question about what healthcare systems could do. And one of the things that I say that is not going to happen, so we have to do our own work, is that reforming, right? This healthcare system was created to do exactly what it is doing, right? The inception of how it was created was practicing on Black bodies without consent. I always recommend people read Killing the Black Body so that you can better understand like why this is happening and what we can do as people who see an issue to help empower our clients that we're working with to ask better questions and to hold their care providers accountable. Like, hey, are you teaching your clients about breastfeeding, or are you assuming that because they're Black, they won't? Are you assuming that a mother is beating her child because the baby has a Mongolian spot and you're just not educated? Like biases also play such a huge role into like the issues that we're seeing. So understanding that like as much as we can do the things and educate, there's also a very sick system that is like cancerous and like it don't want chemo, it don't want anything because it makes so much money off of us like being sick and having all these issues. So I always say like it's as complex as you can imagine, but there are things that we can do, and those simple 3 things could save a lot of people from a lot of pain, heartache, and suffering postpartum, which is eat the protein, 100 grams. Take your vitamin D, check it. We're all deficient, even though we're in South Carolina, like everybody's deficient. Magnesium and calcium will make a huge difference. Will it change everything? Absolutely not. But if you're one of the ones that have these risk factors because of a mineral deficiency, like at the bare minimum, we can start there.
So, okay, what if, this app reminds you to take your vitamins or go sit in the sun if you have access to the sun, or I'm just thinking about like just a simple reminder, because 100% of your text messages get answered or at least seen. You may not answer or reply. You may ignore or ghost somebody, but you will see the text at least. And so just enough of that stat alone says that as a digital a technological healthcare system platform, something like Healthy Mom could actually push a notification to someone in their perinatal period, reminding them. I just think that would be such a game changer. I know it would have changed a lot for me personally. It would have changed things in my own health, and reminded me to prioritize myself, especially as a mother caring for multiple children on top of being, all the other hats that I would wear. So I just hearing you, Tiffany's got me like, what if it was just that simple? You could just send a text or send anyway, I'm over here just imagining and dreaming up some solutions.
Those were all amazing. I hear, consistent theme resonating is advocacy. Like, how do you advocate for yourself, right? Because you have to be a consistent participant in this process as well in order for this to work. So I hear that, when we're talking about how do you mix the digital, with the maternal care, is that the patient also has to be participant in this process in order for that to work. So some stats and bright spots when it comes to the digital platform within the healthcare system that we have highlighted. And one of the things in particular I wanted to pull out was Tiffany mentioned about the blood pressure cuffs. So the Ochsner's Health Remote Connected Maternity Online Monitoring MOM program give patients Bluetooth-enabled blood pressure cuffs and scales. These devices allow for more frequent monitoring of blood pressures, which can help prevent complications from high blood pressure. So, some things are being and taking place in that environment. We just have to encourage, our patients, our community, those that we know as moms, that they have access to these things. According to research by McKinsey and Company, some 70% of consumers now prefer digital healthcare solutions. But while data shows that US women are more consistently engaged in their healthcare decisions than men, digital solutions for reproductive healthcare were lacking. And then, according to February 2023, report by Rock Health Telemedicine reached 80% adoption mark overall, becoming the preferred channel for prescription care and minor illnesses. So these are some of the things that are happening in the technology space, when it comes to the development of bridging the two together. I want to visit the chat because we had some really great comments that dropped in while we were working on our big hairy question number 3. Susan did have a question about how can hospitals or healthcare systems support what's needed. I didn't know if any of the panelists wanted to respond to that. I know Tiffany did in particular. So I know Tiffany C and Dr. R, did you guys want to respond to that?
I just wanted to remind the providers in the hospital settings to listen to your patients. I think that's been the challenge when it comes down to some of the disparities that we hear and experience, whether it's firsthand or through the stories our clients and patients are telling us, is that just reminding them that when they say that they're feeling pain, they're really feeling pain. Like, and not minimizing or telling them that, oh, that's just part of being pregnant, or that's just part of, lactating. That's just part of this, and that. Like, really, as healthcare providers, take their clients, patients very serious in what they're saying. They are the experts in their experiences and what they are inviting you to participate in, because they don't have to tell you anything. But so when they are saying something to you, believe them. So that would be my only add.
Thank you, Tiffany. Dr. R, did you have anything? If not, I'm going to drop the other comment in the chat.
Yes, actually a couple of things on this topic. First of all, I would love for hospitals and healthcare systems not to treat pregnancy as an illness, because it's not. Pregnancy has never been, and it will never be, an illness. It is a natural physiological process of the body. So that's first. That's changing the way we look at pregnancy and how we treat pregnancy is always going to help us reframe systems that come out of it. So that's one. Hospitals and healthcare systems can put their money where their mouth is. They can help fund programs to educate patients about all of these things that we've discussed, right? We know that primary care physicians, OBGYNs, pediatricians, their main job is care for patients. And while it would seem obvious that education is part of that care, it is not always intrinsic to the practice, okay? And so if you are in a system where there are a lot of patients moving through a system, that primary care provider or OBGYN may not have the time dedicated to educate their patients. So what they can do to offset that is to offer specifically funded programs where patients can come get that education. or they can put that money into the community, right? Where there are community centers and community organizations that are providing that education, but need funding. So hospitals and health systems can partner with community-based organizations to provide the education that often does not happen in the clinical setting. And I won't say that, you know, doctors and physicians don't want to educate their patients. A lot of times it's a function of capacity, right? And so what we're trying to do is work together, because often there has been such a siloed navigation of the system that, you know, folks are operating one way over here, folks are operating another way over here, and the poor mamas and babies are kind of the ball is being dropped for them. So that's what I would say.
That's good. It made me think about just kind of the bridge connection between the physician, and then within a county, you can have a community support place that you can go if you're part of this doctor practice. That's your education piece, because women do want to be educated and their families want to too. It's just hard to sometimes streamline that access. So we find that a challenge oftentimes. I want to go and chat in the chat group. Nina made a comment and she said, I think it's important to note that it should be the service providers responsible to establish the visiting and support routine. As a new mom, it's highly likely that you don't know what you need, let alone to raise your hand and ask for help around how you are feeling mentally and emotionally. So that's a very good point, Lina. Sometimes we don't know. We don't know what we need. Ms. White said, yes, educating virtually is a game changer. And Susan dropped a question here that had my brain spinning too. And she said, I love this information. Should this information be shared on the front end during baby showers or family functions so that mom support system knows about what's needed and can be there for that mom during that time? So I think education, like Dr. Ard said, education can happen anywhere and it should happen in any space. I think oftentimes we do a lot of the celebrating, but we don't do a lot of the education piece, which is actually most important. Look, y'all can buy me diapers afterwards. Let's talk about how you can support me on the front end with doing laundry every week or washing dishes or preparing a meal for that mom and that baby to be able to be supported in that environment. So a lot of things, that village sticks there. Education, village, advocacy, community, all of that is a huge part. So guys, we're at Q&A. We want to open up the floor for anyone who is a part of the webinar that may not be on panel, that want to ask our experts any questions in regards to anything that you have, what you've learned today and what you may have brought with you. We would like to open up for Q&A right now. And somebody has to ask one question. Just somebody. And Kim, are they able to unmute themselves on their own?
Yes, they should be able to unmute on their own. We've got some impressive participants, all of you all are. So I don't want to call anyone out, but
I don't either. I know a few people on here. I don't want to call anybody out.
And if you feel more comfortable, you know, putting something in the chat, I definitely would encourage that to do. Oh, so here we have a question in the chat for you now.
Perfect. What are some names of the community organizations that we should look to connect with to provide this service for moms? And, you know, some of you ladies can chime into that. Tiffany, you may know, I know all of you probably know resources that you are aware of that you've referred for your clients.
I think for those that are outside of the South Carolina market or just nationally or globally, if you're, you know, taking a look at this webinar, Postpartum Support International. It is one tried and true organization that offers perinatal mental health resources as well as specialized coordination of resources for those types of aspects of their parenting journey. So they have resources for dads, they have resources for the LGBTQ plus community, they have resources for Black and Brown individuals. We have resources in Spanish right now. And so, yes, that is one that you can actually find national, online, virtual, and then also in your town. And so as a support coordinator, if I get a help seeker, they'll reach out to that phone number or to that website, and they're in this area that I live in, then I'll reach out to them and say, hey, these are the support groups that are offering this. This is a church that offers faith-based maternal health support. And so I think that's a one-stop shop for me. Also, I would like to mention for anybody experiencing a maternal mental health crisis, you can call a hotline that's specific to the maternal experience. And it could be any type of crisis because they'll answer 24/7 in both English and Spanish or other languages with the use of an interpreter. And that number is 1-833 TLC Mama. So TLC, like tender loving care, or T-Boz left eye chili, whichever you want to refer to. And Mama's MAMA. So 1-833 TLC Mama. So that's a resource that you could put in your phones. You could put it on your safety plans or your discharge paperwork. It could be all of that. So if they are saying, you know what, I'm really not feeling it, and they can call anytime and speak to a licensed professional or even a certified peer specialist, someone who has the training and has lived and thrived through their own maternal mental health issues to support them there.
That's amazing. I've had 3 kids and never knew that.
That is new. This is fairly new. This is it's a HRSA grant that is powered by PSI. And that's because there's been a huge lens on maternal health. And they saw a need and put their money where their mouth was and said, let's come up with something. So yeah, this is about 2 years old.
I also wanted to suggest, don't forget your local Healthy Start and community services agencies in your areas. I know here in the Georgia area, the Healthy Starts are kind of in different counties, right? Some of them are attached to the health department. Some of them are, self-sustainable, but they have lots of pregnancy related, baby, child, infant related education, even supports for dads, y'all, right? Because a lot of times dads get left out of this conversation too. And they have fatherhood programs as well. And these are all related to the birthing person, the infant, and the entire family. So they have lots of services. So those are great organizations to partner with. Because a lot of times they already have these systems, these programs that are up and running. So you're not reinventing the wheel, right? So as a healthcare provider or a health system, you're looking for somewhere to really pour your support and your funding. These local organizations need that funding. And again, they're already running these programs. They could just use that extra support. And partnerships are always, in my opinion, the best way to go, because you have an expert that's providing the service and you have resources, and they go hand in hand.
Tiffany, any community entities that you use or reference for your client?
This Tiffany or okay. So
Tiffany T.
If I have clients that are struggling, I do refer them to therapy. And we have, we're local to Columbia, so we do use She's Counseling just because it is a facility of a lot of Black therapists with a lot of different level of expertise. I am still actually looking for someone who is able to prescribe meds, because as a midwife, I can't. That's outside of my scope. And I've definitely had clients in psychosis crisis that I have had to spoon in their bed all night because we didn't have access to care and we couldn't find anybody that even knew what to do. And that's just the reality. I'm not I'm not a native to Colombia, so that's foreign to me where I'm from, because we have all those things, but here it's been a little bit difficult to navigate some parts of that, just because access, like if a client has Medicaid, you know, they might be seeing a therapist that knows absolutely nothing about postpartum mood disorders and things like that. And so honestly, for therapy and things like that, she's counseling. They do have someone who is able to prescribe on staff, but they're not specialists in perinatal mood disorder or anything like that. So that's just, you know, speaking candidly about some of the issues that we're facing is like, well, if I don't have access to it, then how am I going to give my client access? And we don't know where the access is because I haven't found that it exists. So that is a big problem and a big loophole. And that's just the best that I have is referring to She's Counseling. We've had great response, great care. But again, for those who need a little bit more than somebody to talk through, who actually might need meds, a lot of the OBs that we refer to don't know how to prescribe meds for that. So that's just me being honest and transparent as a provider.
That's really good. Kim wrote it into the chat. Access to maternal health is still a gap, even in metropolitan and growing cities. And, you know, to hear that, it's so much work that has to be done. Go ahead, Tiffany. You was gonna say something.
Yes, because Tiffany, man, listen, the way we vibing right now, like all of us are having to be creative, I think, when it comes down to offering solutions in areas where there are gaps and needs. OBs aren't comfortable prescribing to a lactating parent or someone in their postpartum period, but they can. And so if they can reach and have a therapist that can say, like, I'm not a prescriber, but I know that this would benefit this particular parent as they're struggling with their mood or struggling with anxiety or obsessive compulsive disorder during their pregnancy or postpartum experience. PSI offers trainings for providers as well as prescribers. And so that is, and it could be on-demand training, not just be, you know, take them away from their practice for 3 days, but actually can on demand. So that's another resource in our attempt to try to bridge that gap and meet others where they are. Nurse practitioners also are great prescribers too, if they have that psychiatry background. So that we just got to be creative in getting people who can prescribe medicine the training that they need to prescribe to this particular population too.
Excellent. So we're coming up on our hour. Thank you, ladies, so much for your expertise and educating, you know, those who are in the webinar today. This has been phenomenal. I want to be able to give Kim some time as she's working on some amazing things to implement that will support this postpartum support, this village, and everything that we've been talking about today. So Kim, if you can come on and talk about what you're developing right now that will support us.
Wow, this has been such a rich conversation. And some may wonder, okay, why would a software company be interested in a very clinical conversation? So just to kind of take the mystery out of that, I wanted to share a little bit about what we're working on. So for those that know me, I've worked in healthcare for about 18 years on the provider side, helping to lead health systems and medical groups. And at the same time, also been an advocate in the maternal health and infant mortality space for well over a decade, both locally and nationally. And what I found to be true is that it's important to make sure from a disparities perspective, we're looking beyond the walls of the clinic. There definitely needs to be connectivity. But you can see, even in the common themes that we talked about today, access is still a barrier. The importance of a community is needed. And we operate often in silos. So when I think about disparities, and even being a near miss myself, having lost a daughter, Lauren Kelly, 12 years ago, I think about the fact that disparities really can be addressed. About 20% of disparities can be addressed in the room with the physician, right, with direct medical care. 80% is really outside of the walls of the clinic. So Health Evolve has built a SaaS-based engagement platform to address that 80%. So we're in the business of connecting, supporting women, right, with understanding what's going on with their bodies, capturing both biometric and social insights that can create more of a 360-degree view of what's happening to their care team. Of course, we have an AI-enabled care plan. We have some dashboards for the care team, and we do intend to have an EHR integration. But I believe the unique thing that we're building that I'll go to is actually our model and our approach to user engagement, and that's the village. So as you all kept talking about this village in the community, I kept getting butterflies the whole conversation, because when we think about the end user experience, and really this is for all women, right? All women and their families. I kept asking the question, what would make a postpartum mom pick up a phone and engage in something when she's sleep deprived, trying to nurse and focus on baby and not her own body, right? And I thought, it's the same thing I've been arguing about for 10 years. It's the lack of the village. And not just the traditional village, but the ability to have ongoing connectivity to your care team, to a therapy platform, to a loved one, whether that's a spouse, a partner, or a parent that is 5 states over, that can know what's happening with you, as well as to your community support. So this is our I will say our approach, our model of engaging with women in a meaningful way, not just capturing data for people to see, but creating a model that will support them and meet them where they are. It does not replace the physician relationship, but it enhances, because instead of showing up to an emergency room or an urgent care, it can be something you can actually be prompted as the care team member before that person even needs to show up, because you can engage with them more proactively. So I wanted to kind of just create a teaser of what we're working on for several reasons. One, love to get feedback on it. Would love to learn more about how you would see this to be valuable, but also give our community an opportunity to get on the wait list. And as we prepare to launch our go-to-market strategies for next year, 2024. So you see a QR code on your screen. I'd love for you to scan it, sign up to just be anticipating more information, not spam communications and lots of emails coming through to you. Of course, we respect your avenues of communication, but as a way to be in anticipation of what we're building truly for all women, so that we create a personalized care experience that meets them where they are. So I'm excited about it. I was quietly happy with all that came out in the conversation, and the opportunity to make sure we can utilize digital tools to connect clinicians to patients, and patients to therapists, and patients also to their community. So community support. So thank you all so much for today. And I'll hand it back over to you, Rhonda, to wrap up.
Excellent. Well, Kim, we thank you for your vision, and we will continue to support it in whatever way you need us to support. We thank all the participants who were on today, who took the time out of your busy schedule to engage in conversation. It was so much value to the community, and it will do so many amazing things. We thank you, Tiffany Connors, Dr. R, Tiffany Townsend, for your expertise, for taking the time out of your busy schedule as you serve in postpartum support and care. So thank you for your time today as well. Again, the webinar will be posted on the Health Evolve Technologies YouTube page for replay. So if you would like to go back and share it, or you'd like to go back and re-listen, it will be there at the end of this week. We will also have a survey that will follow up after the end of the webinar for you guys to give feedback. Kim would love to do more of these things and engage with you guys in community. So we would love to know whatever way we can support and make this better for you guys to be here. So thank you all for sharing with us this afternoon, and we hope that you have a fantastic week.